Your doctor has recommended a cystoscope. While the idea of a medical procedure can be intimidating, it is very common and safe way to examine the health of your bladder and urethra. It can be performed using rigid or flexible cystoscope. For flexible cystoscope, patient remains supine, while for rigid cystoscope, patient is placed in a lithotomy position. First, look at this animated video of the cystoscopy. To begin, you typically remain awake. A local anesthetic in form of lignocaine gel is inserted into your urethra. Cystoscope is then gently introduced through your urethra into the urinary bladder. To get the clear view, the bladder is filled with a sterile saline solution and then examination is done. As the bladder expands, you have a natural urge to pass urine, which is completely normal. Once cystoscope is inside your bladder, the doctor examines your urethra, then urinary bladder, and in males, prostate also. If a suspicious area is found, doctor might take a tissue specimen from that area, which is also known as biopsy, for further examination. Once cystoscopy is done, you are asked to pass urine. There might be burning or some traces of blood may pass through the urine, or you might pass urine more frequently. These all things happen after cystoscopy. These are completely normal and they generally subside within few days. Now, let us look at how cystoscopy appears in a male patient. As we enter through the external urethral meatus, we first encountered supinal urethra. As I advance my scope, we reach into the bulbar urethra. Next, we encounter the external urethral sphincter. This is what controls the urine flow so that you do not leak. Just beyond this, there is verumontanum and prostatic urethra starts after the verumontanum. We can also see the prostatic lobes on either side of the prostatic urethra. After crossing the bladder neck, we enter into the urinary bladder. Inside the urinary bladder, we examine the right ureteric orifice followed by left ureteric orifice. The ureteric orifices are the area where the urine drains from the kidneys into the bladder. Now, the area between the two ureteric orifices and the bladder neck is also known as trigone. We perform a systemic sweep examination from the left lateral to anterior and then right lateral and posterior wall of the bladder followed by the dome. We can notice mild to moderate amount of trabeculations present in this cystoscopy. Now, once the examination is complete, we drain the urine and measure the bladder capacity. Now, once we are removing our scope, we have a final look on the prostate and urethra as we are on our way out. In female patients, the procedure follows the same path, but it is rather quick because of shorter length of the urethra. We transition quickly from urethra through bladder neck into the bladder. Here we have a comprehensive examination of both the ureteric orifices and the bladder. All the bladder walls are examined to ensure everything looks healthy. Once the procedure is complete, you are allowed to urinate. That's it from my side for today.